As a physician, you ever wonder if your patient is a drug seeker? Here's some red flags to look out for. One red flag is they come from a town that not many other people come from, maybe even across state lines. Another giveaway is they've seen many physicians in a short amount of time asking for the same thing. So another giveaway is when patients bring in all these records of their ailments, but they're from years past. And they bring them to different doctors, and they just carry this around with them all the time, showing them, look at this MRI, there's a disc that seems to be a little bit off here. I've had all these x-rays done, I've seen all these different docs, but nothing recent. When your patient uses multiple pharmacies, watch out. That means they're usually doctor shopping and they got many medications from different places, and they have to go to different pharmacies so the pharmacist doesn't catch on. I saw this a lot when I worked in the immediate care. Patients would come in and they say they had allergies to all pain meds except this one that they're seeking. It was the only one that worked for them. Everything else they had an allergy to. When the patient doesn't want to listen to anything you have to say that may help them, but instead says, hey, I want this pain medication, this dose, and this quantity, that's a red flag. When your patient isn't willing to consider any other type of treatments, all they want is their medication. They don't want to be helped with anything else. It's just, hey, I want this medication. That's all I want from you. Patients who are truly in pain want it to stop, and they're willing to try many other modalities to make that happen. The patient calls your office right before it's going to close, or right before a weekend or a holiday, and they want some pain meds. Another red flag would be if the story just doesn't make sense. Your patient is lying and you caught them in a lie. You can see from past records, perhaps you've been in the emergency room as a physician and you're seeing what they've been on in the past, and they're telling you they've never even been to this emergency room in the past. I've seen patients exaggerate their symptoms. They come walking into the office just fine, into the exam room, and then I'll walk in and they'll grab their back and be moaning right as I walk in. It just doesn't make sense. They're very good actors. And then many times what I'll do is I'll watch them walk out of the office, and not only that, I'll watch them through the window get to their car. And it's amazing how much better they must feel now that I'm no longer around. Another red flag is that if your patient gets aggressive when you try to talk to them about perhaps a different modality, a different medication, a different type of treatment, but instead they want that medication and they're getting very aggressive about it. Your patient gives you a false address or a disconnected phone line. So false information, usually a giveaway. Lastly, your patient is taking multiple controlled substances. Usually that's a good sign of a drug seeker. Now, as a disclaimer, just because you may have some of these red flags that you see doesn't mean that the patient is a drug seeker. They may be truly in pain. And it's our job to kind of give them the benefit of the doubt, examine them, and see, what we can come up with. But if they seem to have many of these red flags, or they're coming in with different stories all the time, they've tried this medicine, and nothing seems to work, then you need to be a bit suspicious, and you might need to take a step back and try to get them into pain management or an addiction specialist. I would really appreciate if you would like and subscribe to the channel. Thanks so much.